guys, this is the last video of the morphology lesions of the skin. In this video we will talk about the secondary morphological lesions of the skin. What is it? Are the result of the evolution of the primary morphological lesions created by scratching or infection. They include erosion, ulcer, squama, crust, scar, fissura, excoriation, spot, vegetation, and lichenization. We will talk about it one by one. Erosions is a superficial skin defect within the epidermis. Erosions appear after the rupture of the vesicles, bullae, and pustules, and are of the same shape and size as the primary morphological cavity lesions. They are usually pink or red and have a moist, weeping surface. Small lesions form in rupture of the vesicles in patients with eczema and herpes zoster. This secondary morphological lesion heal without leaving scars. The next secondary morphological lesion is called ulcer. It's a skin defect with the involvement of the epidermis, dermis, and sometimes the deeper lying tissue. Ulcer develops from tubercle nodules and after the rupture of the deep pustules. The trophic ulcers alone forms as the result of the primary necrosis, singling healthy tissue because of its disturbed trophic. Ulcer may be spherical, oval, or irregular shape. The surface of the ulcers varies in color and in form, like bright red to cyanotic congestive. The floor may be uneven and covered with a serous purulent or sanguinous secretions. In purulent inflammatory process, the edges of the ulcer are edematous and soft, and there are abundant purulent discharge and diffuse hyperemia around the ulcer. The next secondary morphological lesion is called SQUAMA, are detached horny lamina. These lamina are removed by washing and rubbing of the skin. They are seen in some pathological conditions, and they are characterized by the process of the abnormal desquamation. The color of the scales may be white, green, yellowish, or brownish. According to the size of the squama, can be purpuraceous, that is small and fine, or lamellar, that is large. The knowledge of the forms of the desquamation and type of the scales help in the making of the diagnosis of some dermatosis diseases. The next secondary morphological lesion of the skin is called CRUST. It is formed when a serous exudate, pus, or blood, sometimes with a mixture of the drugs applied, dries on the skin. Therefore, serous purulent, sanguinopurulent, and other kinds of the crust are distinguished. They result from the drying of the vesicles, bullae, and pustules, the ulceration of the tubercles and nodules, in necrosis and purulent melting of the deep pustules. The color of the crust is determined by the character of the secretion from which they formed. They are transparent or yellowish in a serous secretion, yellow or greenish yellow in a purulent secretion, red or brownish in a sanguinous secretion. Crusts appear on the skin in scabies, mycosis, pyoderma, eczema, and neurodermatitis. The next secondary morphological lesion of the skin is called scar. It is formed in the place of the deep defects in skin which have been replaced by coarse fibrous connective tissue, collagen fibers. Cicatricial tissues are containing no hair, sebaceous or sweat glands, vessels, or elastic fibers. A scar forms at the site of the deep burns, cuts, ulcerate of the tubercles, nodules, or deep nodules, or it may be formed in the dry manner. without proceeding ulceration. Scars can be divided in the following: atrophic, hypertrophic, prematrophic, and keloid. First, scars are red or pink. Older scars are hyperpigmented or depigmented. Scars may be smooth or raw. Hypertrophic scars rises above the skin surface and form as the result of the excessive amount of the hair fibrous tissue, and they are called keloid scars. The next morphological lesion of the skin is called fissura. It can be superficial or deep. Superficial doesn't penetrate beyond the epidermis and helps without a trace. Deep forms in the epidermis and the dermis, sometimes with the involvement of the deeper tissues, and leaves a scar after healing. Also, we can find the linear fissures, that are the defects in the skin, appear when the skin lost its elasticity due to inflammatory infiltration of the skin. The next secondary morphological lesion is called excoriation. It's the skin defect resulting from the scratch or some other traumatic damage. If only epidermis and dermis involved, then no scar present. If deeper penetration, then a scar forms. It is objective sign of the scratching itching. The localization and shape of the excoriation sometimes help in making the diagnosis. In this case, also we have the spots, which develops in the process of the evolution of the primary morphological lesions, giving us we will focus in the dichromic spot form, that is the depigmentatic and hyperpigmentatic form, that we will see more prominence, but is the same because it's the evolution of the primary morphological lesion. The next secondary morphological lesion is called vegetation, formed in the region of the persistent inflammatory process as the result of the intensified proliferation of the epidermal prickle cell layer. Have appearance of the villi, dermal papillae which lend them an even nodular character resembling a coxcomb. Color can differ based on the presence of the discharge, from bleeding or secondary infections, from gray to red or yellow, can be hard or tender. The last secondary morphological lesion of the skin is called lichenization. It's thickening and hardening of the skin marked by the exaggeration of its normal pattern, hyperpigmentation, dryness, rawness, and sugar-like appearance. Lichenification may be primary, developing as a consequence of the long-term irritation of the skin by scratching, example in patients with neurodermitis, or secondary, and influence of the papular lesions, example psoriasis, lichen planus, chronic eczema, and neurodermatitis diffuse papular infiltration. I hope I have helped you with this topic, and if you want more videos like this, please don't forget to comment and let us know your requirement. For me, it is very important. Thank you so much. Bye bye.